Coffee with Coker is a healthcare business podcast from the Coker Group that focuses on solutions to help healthcare organizations effectively navigate the changing healthcare industry landscape.
All right, welcome back to another podcast episode at Coker, where we're going to continue our Physician Enterprise Performance Improvement series. Today, we're going to be talking about staffing, non-provider staffing, and how that relates to performance. Quite the hot topic at current state with all the things that have happened around AI and automation and telemedicine and coming out of COVID and remote work. So much to discuss. We're going to try to keep it focused to some degree on the performance side, but we'll also talk about some of the pressures and the kind of the future of where this is headed. This is Brant Jewell, Senior Vice President at Coker. I'm joined today by Andy Sobczak, Senior Manager, Kelly Rafael, Senior Manager, and Baines Welch, Senior Associate. And that we all work together on a number of different areas for the firm, but specifically around physician practice and physician enterprise operations. So looking forward to jumping into this today and just covering some of the areas and trends to begin with, and then we'll talk about how we analyze staffing and some of the things that we like to deploy as solutions once we do have an understanding of what's working and what's not, how we measure it, how you can use data to your advantage. And then we'll talk about kind of the impact of technology and some of the things that we see coming that we think will be relevant to not staffing the same way you have in the past as we move into the future. So I'll stop there with the introduction and turn it over to Baines to go through some of the trends and evolution of non-provider staffing and physician practices.
Thanks, Brant. And I know, much has been said about the staffing shortages and physician workforce issues that have been plaguing the healthcare industry recently. So I won't belabor the point, but I do think just going through a brief background of the current landscape where, the U.S. has lots of baby boomer physicians and nurses that are retiring or already retired, and the system has struggled to replace them with younger talent. Since 2019, Health Affairs noted a 4% reduction in registered nurses younger than 35. And for lower wage healthcare workers who don't have the credentials or licensing that the nurses do, they have lower switching costs moving to another industry, doing service or clerical work. And so the industry has just been unable to replace the workers that it's losing each year. The COVID situation stressed the system. The travel nurses making, double or triple the money elsewhere turned into issues where some nurses leave to go become travel nurses. Their friends hear about how much they're making. They leave. It snowballed into this massive issue. We finally started to really reset and return to normal a little bit there, but it left some scars on the staffing system. So these issues have not affected everyone equally. Some specialties are worse off more than others. Surgical specialties that are generally higher margin have been more easily able to compete and pay higher wages to attract and retain talent, whereas primary care specialties generally struggle. The rural communities have been hit especially hard, having difficulty finding qualified people, as well as keeping up on compensation. We talk a lot about compensation when it comes to staff, but there's other costs involved in this. When you have a lot of high turnover, it contributes to large knowledge loss, right? You have inexperienced new staff teaching inexperienced new staff, and that perpetuates itself. Cycle after cycle, you just get worse, and eventually your staff are not doing as much as the previous ones were. Furthermore, when we think about why staff really leave, compensation is certainly an important factor, but management, culture, work-life balance are all important factors that we'll get into later about ways that you can address those issues, promote a healthy environment where you aren't just having to pay top dollar for staff to come stay with you. Kelly, do you want to talk a little bit about how, if someone wants to look at their own staffing situation, analyze what's going on at their practice, how they would go about it?
Certainly. Thank you, Baines. So we like to embrace a data-driven approach to staffing, productivity, and position control. And so I'll just give an example of when we're doing assessment, what we look at. So there's several key benchmarks that we like to utilize. First of all, we like to evaluate the total staffing spend. So we look at staffing compensation and benefits as a percentage of net revenue. And we like to look at how that compares to national averages. We also like to consider staffing in relation to practice productivity. So how many staff does it take to produce a certain number of work RVUs? So for that measure, we look at staffing per 10,000 work RVUs, which is a work relative value units that gives a universal measurement of productivity across specialties. And for some positions, it can be helpful to do a time study and compare to industry averages as well. So revenue cycle management tasks, for example, can be good candidates for this. You can look at the number of claims billed by your staff as an overarching metric. You can also get very granular and look into how long it takes to do each task in the billing process and compare that to industry standards. So those are some of the things that we look at. But we do caution that these metrics should be considered directional in nature. But there's several things that can tell us. It can tell us, how does the overall staffing level compare to industry averages? How does the staffing mix compare? Is the staffing mix for the practice more heavily weighted towards administrative versus clinical positions, for example? But it's also important to understand the unique characteristics of each practice and how that impacts staffing levels. So that means that the just right staffing level for one practice may be higher or lower than industry benchmarks based on its unique characteristics. So smaller practices, for example, may require a higher staffing ratio in order to meet minimum staffing thresholds. Other practices may utilize their staff differently and rely on clinical staff to perform some tasks that would normally be performed by front office staff, for example. And that should be taken into consideration if you're comparing to clinical staffing benchmarks. So basically, when you're viewing staffing levels in comparison to benchmarks, you really need to do a gut check and to determine how it applies to your practice. So with this information in hand, a practice can work to create its own staffing targets. Medium staffing levels may not be a realistic target for a specific practice. So you can determine what would be the most appropriate target and set your own internally developed target and staffing ratios based on your unique set of circumstances. So if you happen to be above the target currently, you can consider ways to grow the practice that can be supported by your existing complement of staff. Or most likely, which is the situation today, if you're below that target and struggling, you can look at strategies for recruitment, as well as identify ways to increase retention to help reduce the turnover rate. And we'll be talking about this throughout the podcast today. And the bottom line is that staffing benchmarks can provide helpful guidelines to evaluating your staffing level and complement of staff, but will need to be adapted to your unique circumstances. And so now I'll turn it back over to Baines, who will share some solutions to staffing challenges.
Thanks, Kelly. I think we'll start with the most common solution, which is just increasing compensation, right? But in a world with, health systems have their lowest margins ever, private practices are struggling. Salary increases are tough to do. And so the best way to go about that is to mitigate the impact of these costs by driving better performance, better results, from your staff after increasing these salaries. So there's several ways to do that. And one that's been talked about a lot is APP utilization, using them as physician extenders to increase revenue, make your providers more productive and see more patients to help offset these salaries. One thing we talk about a lot is having staff practice at the top of their license. So for RNs, they can do things like annual wellness visits. Most practices have RNs doing patient intake, and they can, and they certainly do a great job of that. But is there an opportunity there to utilize medical assistants more to do that patient intake and save your RNs for doing things like triage, annual wellness visits, and other things that only they can do? So it's important to kind of take a look at, are you getting the most out of your staff because you are having to pay more than you ever have? Another way to sort of offset these salary increases is to give them in the way of performance bonuses. So, for example, you have your front desk and give them a collections goal, and if they hit it, then they get a percentage of that pot as a way to, instead of increasing their base salary, you sort of tie their performance, the practice's performance, to their compensation. It's a great way to get more out of staff and improve your practice. One other way we found that was effective is inspiring staff to go get better credentials, improve their education, and increase their job skills. So if you tie a performance, essentially a salary increase, to getting better credentials, taking classes, learning more, so that they're better at their job, that can be an effective way of getting better performance out of each staff member despite having to pay more money for it. So those are some ways to offset the salary increases that you may have to do in order to keep staff. But there's other ways, there's other solutions to keep employees without having to necessarily pay them more that Andy can talk us through.
Great. Thank you, Baines. And to the topic of retention and turnover in healthcare, it's not the greatest news. Healthcare turnover right now is probably around 30%. You see different numbers in different places, but it's pretty high compared to other industries. I also came across a study by Ultimate Medical Academy, which is an organization that trains medical assistants and other allied health professionals. They did a study of about 1,000 employees not too long ago, and they found that 60% of the people they surveyed are expecting to leave their job in the next 5 years. Of that group, they cite pay, engagement as reasons for leaving, but also they don't have a career path, or they don't see upward mobility or things of that nature that keep them satisfied in their job. And so I think a lot of this it leads to, are your employees, is your staff engaged? Gallup estimated not too long ago that low engagement teams have turnover rates that are about 18 to 43% higher than teams that are highly engaged. And so it is very important, particularly in healthcare, where we have challenges retaining staff over the next several years. They're predicting staff shortages alongside physician shortages. The AHA estimated about 3.2 million healthcare workers we'd be short 3.2 million healthcare workers by 2026. Just to keep that in a frame of reference, there's about 15 million healthcare workers right now. And so, potentially a pretty big deal. And so retaining staff is critical moving forward. And some of the ways that we see high performing organizations do this is through career progression opportunities for staff, but also ensuring staff feel as if they're owners in the process. And so some of the things that we look at are, do the job descriptions have very specific goals and objectives tied to the role? Do the staff have an idea of whether or not what they're doing is going to impact the organization in some manner? And so we recommend, in this case, a lot of organizations to use key performance indicators for all staff. They don't have to be fancy. It's just some way for staff to understand how their work ties to either the bottom line of the organization or the quality of care of the organization. You should have some level of goals and objectives for each role so that team can feel engaged. They can feel as if they're owners. Another important piece here is career progression and ensuring that folks that are on your team have a pathway forward and that you're engaged in that process. A lot of times folks leave their job because of a manager, because of the way a supervisor may treat them, or look out for their career moving forward. And so really it can be just as simple as taking employee feedback or conducting engagement surveys and acting on that feedback. In some of these surveys and studies that I looked at here, one of the key kind of focus areas is taking staff feedback and acting on it so that they have a sense that leadership and ownership is actually listening to them and that their feedback actually matters to the organization. So those are some of the kind of soft skills that really make a meaningful difference as it relates to retaining staff, in addition to, of course, increasing salaries to be market competitive. Frequently find organizations chasing that market-based pay for their staff because it just continues to grow. And so outside of that, having some of these structures in place, well-organized job descriptions, goals, performance indicators that can be tied to individual roles, but also tied to a performance incentive or bonus at the end of the year for staff. And so ensuring these structures are in place to keep your team engaged, but also feel as if they're owners and tied to the success of the practice or the organization. On the flip side, as it relates to something like position control and how you manage the overall number of folks in your workforce, we like to evaluate what practices and hospitals do if there's a vacancy. Is there a process by which they review that vacancy compared to their needs? And so is that a position they need to continue to fill based on whatever benchmarks or metrics are in place for the organization, or do they just greenlight it automatically? We don't necessarily abide by one approach to position control, but more so, is it something that's reviewed whenever a position is opened, whenever you want to hire a new role, or something that's reviewed on an ongoing basis, like quarterly or annually, if you're looking at the level of staff that you have, the volume of their visits, hospital stays, whatever it may be, and are you staffed to meet those needs? And so we highly recommend some level of position control process for any organization as it relates to new openings, filling vacancies, and then an ongoing just kind of evaluation of workforce needs. And I think here, as we kind of come to the close, Kelly's got some additional best practices and things to consider for optimal results within your staff.
Yeah, thanks, Andy. So building upon the retention strategies that Andy shared, what are some best practices that will position your employees and the organization for success? Well, many of these best practices are things that you've heard before if you've listened to some of our podcasts, because really it comes down to what we like to call basic blocking and tackling. So this includes having formal written policies and procedures that are communicated widely and can provide a roadmap for day-to-day operations. So that type of structure is important in order to position your employees for success and to help point them in the right direction. And the importance of a structured training and onboarding program can't be overemphasized as well, and can be a key retention strategy. Because if you think about it, during the onboarding process, that's the first introduction the employee is having to your practice. So you want to make sure that it's a welcoming and a supporting experience, and that provides a great framework for them to be successful in their role going forward. Instead of being thrown to the wolves, is what we hear some of the employees that we interview tell us. So really thinking through how to create that structured and supportive onboarding program is important. And also building upon what Andy shared, it's important for employees to understand their roles and how their work supports organizational goals. So what we like to advocate is the use of cascading goals. And what we mean by that is establishing organizational goals, so those overarching goals, and clearly communicating those across the organization. And then creating those key performance indicators that Andy talked about for each role that are linked to those overarching goals, or that they cascade from those overarching goals, and then evaluating your employees against those KPIs. Consistent communication from morning huddles to monthly staff meetings to day-to-day interactions is key. And pretty consistently, one of the biggest opportunities for improvement we hear from staff interviews is the need for better communications. So it's important for you to find ways to ensure your employees feel they're being kept in the loop, and also that they're being heard. And staff cross-training is another best practice. Not only does this provide greater flexibility and sustainability for your practice, it also helps to develop your team members, creating greater employee engagement and retention. In addition, it helps to promote greater collaboration across the practice.
Thank you, Kelly and team. There's so much bothering physician enterprise managers right now about staffing. I think part of it is the current financial pinch, and not just a pinch, but extreme rising costs of the staff and the infrastructure you've had in the past. When we compound that with not being able to find people, not being able to retain people, and then go beyond just people and think about talent and how we groom our own talent, how we develop the capabilities and skill sets that are truly valuable as opposed to just filling seats. It's a multi-layered issue that's significantly impacting the financial and operational performance. And it is both. It's impacting the financial statements, and it's impacting workflows and capabilities and resources in a way that truly we probably haven't seen before. And that's going to require everyone to rethink
how they do this moving forward. And it's very different for a small practice, independent group compared to a large enterprise where there may be some centralized resources and infrastructure and float pools and things like that that you can pull from. But one of the critical issues when we do this for independent practices is the backstop issue, and what happens when the one person we have performing this function or this role is out for a day, out for an extended period of time, or leaves altogether. And it's amazing how many practices are critically dependent upon an individual or an individual skill set, and that presents a lot of risk. And so we've recently had a lot of inquiries and or worked with a lot of groups that are either interested in outsourcing, interested in developing their own management services because they see such a need in the market. And so the amount of activity we're hearing in this space is highlighting for us anecdotally, among all the data that is available, how much of a problem this is and how pressing it is. Naturally, we are seeing companies and technologies pop up everywhere to try to help address these issues. Internally at Coker, we still think that this is a people business, and the fundamentals that have been mentioned today around communication, aligning incentives between all staff members and the organization, using data to make decisions, not knee-jerk reactions as to whether we hire or fire. Those principles aren't going away, but embracing things like patient portals and texting patients and patient direct scheduling and some things that have been taboo among physicians in particular over the recent years may not be an option moving forward. And it depends on your practice setup and it depends on the environment, but we're seeing a shift in consumer/patient expectation in this department, as well as physician and or practice willingness to more directly communicate with patients like we are doing in all other industries and areas. So COVID certainly poured gasoline on that fire with the acceleration of telemedicine and the adoption of that, because of that adoption and how prevalent and capable most physician entities are now with virtual visits of any kind. You've seen a lot more adoption of patient portals. And now if I'm going to be doing virtual visits, I've already got to log in and be online. I'm starting to get used to communicating with my physician office in this way. So now the patient portal seems to be more attractive, or like something I will use more frequently. We've also seen those get better and better and be integrated with EHRs as opposed to standalone sidecar softwares. So it's less clunky. It makes more sense. Staff and providers are more accustomed to using it. And so some of these basics that were not adding a lot of value or having low adoption rates pre-COVID, let's say 5 years ago, are now getting a lot more adoption. And yet I still think those are the basics, right? Online scheduling, communication and messaging with staff, the patient portal as a place to see results of lab tests, et cetera. And then the concept of virtual visits. Those are now fundamentals for practices, and they impact your staffing, right? The amount of virtual visit shift you've experienced, and it could be different by specialty, location, et cetera, should and does impact how you staff today and what you are staffing for in the future. The other technologies that we've seen popping up, whether that's insurance eligibility, direct patient communication around clinical protocols, and some of the ways that we can use clinical data to drive visit volumes and or prompt routine care visits, remote patient monitoring, transitional care management, chronic care management, all the different things that are still feeling a little more progressive are becoming more and more available. We're not seeing adoption at a widespread rate from these groups, but it is going to continue to be available and get better and better. And whether you want to embrace it or not, if it can help alleviate some of your staffing issues and having good phone systems or automated reminder systems, centralized call centers, all of these things that can really impact how many people you need to hire and how you interact with patients. I think we're going to begin encouraging groups to pursue those more than we have in the past. And then that's something that I think is a shift for us in our business. The big one that we haven't really talked about here is AI and kind of workforce automation. You can go down a big Google rabbit hole at your own leisure as to what all AI can do and who it will replace and how much can be automated. But there are a number of tasks in the business of healthcare that are repetitive, automated, and require discrete data. I don't think that we're going to replace our whole workforce. Then Coker, like I said, still feels like this is going to be a people-driven business, and that's going to be important. But how AI develops and which specific areas around, claims processing, coding, et cetera, it may not replace all of your people, but it may give you options to have resources and backstops for the staff you currently have as you move forward. We are not pushing the adoption of AI to reduce staffing burden today, but I think we see a day in the not so distant future where you will have some good options that are AI driven and or automation driven that could really impact your staffing burden and your staffing expense, and hopefully in a positive way. So we encourage you to continue to look for that and consider embracing it versus fighting it. So all this is to say, whether you're outsourcing, automating, leveraging technologies you've been using for a while, but leaning into them more, we're in an environment now where you likely need to look beyond the traditional methods of staff management and just throwing people at the problem, hiring a staff person because a physician walked out of their room and there was no one available. Those are kind of antiquated and really unrealistic expectations moving forward, for all the reasons that we listed today. And so we view this both from a performance improvement perspective as an expense play and getting the most ROI for the infrastructure. And it's important to understand where you stand today and using the perspective, as Kelly mentioned, of what national benchmarks look like in that regard, and then saying, well, we're pretty close, but we can do better, or we're way off one direction or the other. And why is that? Is that sustainable? That can give you good perspective, but ultimately, we want to see you set your own targets as it relates to the cost of your staffing infrastructure, and then consider the alternatives if you need to. If you're having trouble finding talent, you can replace some of those costs with outsourced costs and maybe get a better version of performance. And then secondarily, but equally as important, is the functionality. What you can't afford to do is cut costs or employ workarounds that require less financial burden, but give you subpar customer service and patient management. And that can be both clinical and billing and front office or call center related. So it has to be a balance. We do not have a silver bullet staffing solution. There's no one right way for you to set up your staffing infrastructure, and anchoring to somewhat where you are today and where you've come from and your unique culture at your organization, and then being able to visualize a future state of that same culture and or an improved version is what we'd like to see, both from a revenue perspective, expense perspective, and then ultimately an operational workflow and patient, provider, and staff satisfaction perspective. So this will continue to be a hot button, I believe, and we're interested in hearing what you're doing that is working, the struggles you're facing that seem insurmountable. So we would love for you to interact with us on this topic, as we're all still kind of in real time learning about which directions and this is going to go and what's going to work and not work. So thank you for listening today. As always, we look forward to continuing this series, and we will talk to you again soon.
We hope you enjoyed that episode of Coffee with Coker, and we thank you for listening. We want to encourage all of our listeners to participate and contribute in the podcast. So if you have any questions on any of the things we discussed in this episode, any of the topics that were presented, please feel free to ask us. Also, we welcome your feedback and suggestions. If you have any ideas related to the material we discussed in this episode, or in any episode, please let us know and we'll make sure to incorporate it. And if you have ideas for topics you'd like to hear more information about in future episodes, please send those suggestions to us. We would love to hear them, and we'd love to incorporate them into our future episodes. You can find us online and on social media. Start with our website, and specifically the podcast is coffeewithcoker.com. can also find that through the main Coker website at cokergroup.com. You can also find us on social media, Twitter at Coker Group, and then on LinkedIn, you can search for Coker Group and find our page and the page for some of our team members as well there. So you can find us and reach out to us in a number of places. And then if you want to contact us directly, one of the best ways to do that, email feedback@cokergroup.com. That's feedback@cokergroup.com. And again, we'd love to get your feedback, and we'd love to encourage everyone to subscribe to the podcast so that you can be notified when future episodes are released. We look forward to the next episode, and we look forward to getting your suggestions and feedback on this episode. Thanks for listening, and we look forward to speaking with you again on future episodes.